When my son was really, really little, he was fearless. He taught himself how to swim. He would just go running and jump into the pool, and I'd be running after him. Because he would just jump right into the deep end. 8 years old was the first time that he went into a hospital for his mental health. He wanted to kill himself. He had actually, at 8 years old, attempted suicide.
Nina DiConcini has been fighting for her son's mental health all his life. One afternoon in April, that fight nearly killed her.
He ended up cornering me in my kitchen with a 2x4 in one hand and a knife in the other. He's threatened me, he's threatened my life before, and always the look in his eye that I always saw was, am I gonna follow through on it? And this last time, I saw, am I going to beat my mother to death with this 2x4, or am I gonna stab her to death with this knife?
DiConcini says the juvenile court sought Level 1 residential mental health treatment for her son. Level 1 facilities are locked down and provide 24/7 medical care and supervision. But Cenpatico Integrated Care, the regional behavioral health authority for Southern Arizona, denied the request.
I remember one of our last court dates, the prosecutor attorney is like, well, we need to get him into a Level 1. And my son's attorney, well, we need to get him into a Level 1. And the judge asked, well, how do you feel about that to my son? And my son's like, yeah, I need to get into a Level 1. And I'm saying that, and the PO is saying that, and we're just all sitting here in agreement that that's where he needs to be, but we can't figure out how to get it paid.
Regional Behavioral Health Authorities, or RBAs, coordinate and pay for behavioral health care in the regions they serve. Cenpatico became the RBA for Pima County just last year. Before that, the nonprofit Community Partnership of Southern Arizona held the contract for 2 decades. The for-profit Cenpatico has come under fire over the past year for the changes it's making to the mental health system, including service denials.
Thank you for calling NAMI Southern Arizona. This is Carl. How may I direct your call?
My phone rings frequently with people who are not able to get the services that they were previously able to get.
In the Southern Arizona chapter of the National Alliance on Mental Illness, Clark Romans works with provider agencies funded by Cenpatico and with individuals and families who receive care. He says that although Cenpatico aims to improve mental health services in Southern Arizona, its approach is putting pressure on patients and providers alike. More frequent reporting and audits stretch understaffed agencies thin, and reduced funding can push smaller agencies to the financial edge.
Many organizations have been told you better have a lot of money in the bank because you're not going to get paid this way anymore. I don't know if you've ever ridden over Niagara Falls in a barrel, but I have the feeling this is maybe what it feels like.
One local behavioral health agency bracing for that fall is Cafe 54, a downtown restaurant that employs and trains people living with a serious mental illness.
We're not just training people how to chop vegetables or serve food. We are working with individuals to overcome all the barriers of low self-esteem, confidence building, social stamina, which we take for granted.
With their funding cut earlier this year, the cafe faces a gap of more than $250,000 that threatens to shut it down. Cenpatico CEO Terry Stevens says she recognizes the challenges that have come with the RBA transition and is now trying to ease the burden on agencies.
We re-looked at all of the auditing, all of the what we call deliverable requirements, and we've begun to reduce them.
Stevens, who once worked as a child and family therapist, has said that she opposes residential treatment for children because it can be traumatic and ineffective. Yet she denies that Cenpatico refuses every request for that level of care.
I think it's really important that you know that it's not that we never use it. Today we have 140 kids in some kind of out-of-home placement. So it's not that it's never used. I never interfere with what our doctors decide.
To connect with the community and its concerns, Cenpatico hosts public forums at least once a year. In its most recent one, Stevens met with frustration and pain.
I've never seen such a problem before.
Case managers are turning over left and right in the Cenpatico system since their integration.
And it's not enough to say, call this number as Cenpatico. That's not enough.
This is nice, but this is not reality. We have to find ways to overcome these barriers.
Yep.
No, I understand what you're asking for. And we've been involved. We walk away from those with ideas. We walk away from those sometimes with complaints that we look into. Because I really do believe that the only way we improve the system is if somebody tells me something's wrong.
Stevens says she intends to earn the community's trust and resolve the problems that have marked this first year of Cenpatico's contract.
Contrary to belief, I'm not a bad person. I actually am somebody who really does care about the behavioral health system. I've worked in it 30 plus years, and my intent is to make sure that providers do it the best they can and that our members get better. And you know, you wouldn't do this for 30 years if there wasn't a reason.
The risk is that resolution won't come soon enough for some.
I think the community will survive this. What's kind of not visible in a lot of cases are the lives that have been partially or permanently ended or damaged, or setbacks that have occurred to people as we in the community and these organizations have tried to make this shift.
Ultimately, the juvenile court system paid for Nina DiConcini's son to receive Level 1 residential treatment. But she worries for what will be available to him and to herself and her young daughter when he comes home.
I hope that he can be a productive member of society, that he can make contributions to society in a positive way. My son's 15 and he still gives me hugs and he still tells me that he loves me and he still kisses my cheek and things like that. And so I know that love is there. There's so much on the news about mass shootings and people going off and hurting other people. And it breaks my heart. My heart always goes out to the mother of the person who's doing that. Because I sit there and I go, that could be me one day. If my son can't get the help that he needs, that could be me one day looking on the news and saying that's my son that's doing these things to other people. Why would they be willing to put the lives of myself, my daughter, and my whole community at risk?